So having two 6-month-olds when I started my intern year was really challenging. Hey y'all, welcome back. Mama Dr. Jones, OBGYN and mom to 4. I asked you guys on Instagram what questions you had for me. Some of them are medical, some of them are personal. I'm giving you as many answers as I can, but there's like 1,500 questions, so we're not gonna get through all of them. If you don't follow me on Instagram, head on over to Instagram so you can be included in the next Q&A. Let's jump into it. I need to get my hormones checked because I'm tired a lot. Hormones are always changing, so you can't just like draw blood and look at hormone levels and go, oh, yep, here you go, you have a hormone imbalance. That doesn't have a medical definition, hormone imbalance. You'll hear lots of people who are trying to sell you something on the internet, say you have an imbalance of your hormones, check out my diet. And it's nonsense. There's not a medical definition. I can't just run a panel of hormones and tell you what's out of balance. And the reason is because hormone levels change throughout the day. They change throughout the month, depending on where you're at in your cycle. And they have a very wide range of normal because of this. And so, yeah, I don't think that getting your hormones checked would tell you why you're tired all the time. Maybe a thyroid problem could make you feel really fatigued if you had low thyroid levels. But in general, the culprit of being tired all the time, and I know this far too well, is not spending enough time, just downtime, meditation, getting enough sleep, especially when we're up late on our phones. You know, the phones have a blue kind of light, and that light makes your brain think it's daytime, and your brain is not producing the melatonin that it should be as you're preparing to go to sleep. One thing you can do is we call these sleep hygiene things. So put your phone to bed a couple of hours before you put yourself to bed, and do it at the same time every night. Go to bed at the same time every night if you can. If you are not getting 8 hours of sleep a night, you need to do that. You need to figure out how to make that happen. And I am so bad at this because I'm really productive at night. I'm a night owl for sure. If you follow me anywhere on social media, you know a lot of times I'm up in the middle of the night posting things because that's when I am awake. Like, I don't know, I'm a night person. But get off your phone a couple of hours. I'm like giving you a speech and then literally referencing that I am up in the middle of the night on my phone. Adorable. So put your phone to bed a couple hours before you're going to bed. Try to go to bed at the same time every night. Get that full 8 hours of sleep if you possibly can, especially if you're struggling with fatigue. And get into a good exercise routine. Get yourself moving every single day. Do some sort of exercise. Get outside. Let the sun hit you. Do those things and do them consistently and see if it helps. It's also really helpful to get up at the same time every day because that kind of trains your body to know it's time to be awake. I don't do this well either, but if you get up at 6 a.m. for work, keep that schedule on the weekend. Don't sleep in. Try to maintain a schedule and see if doing those things will help. Obviously, if you really think you have something going on that's more than just, I'm a little bit extra tired, talk to your doctor about it. But if you've been feeling extra fatigued or tired during the day, like so many of us, reevaluate some of your habits, especially with quarantine. Everybody's doing things differently, and you might find that it's helpful. What was your experience like having kids while in med school? How did you do it? I have a whole video about having kids in medical training, but my twins were born like 6 months before I finished medical school, and the last 6 months of med school are relatively easy compared to the rest of it. So I don't know that I can really say I had kids in med school, like it was technically med school, but I didn't have a lot of studying left to do over those next 6 months, and we were just basically in the process of finding out where we would be going to do our residency, and we did a lot of like easy rotations or fun rotations and not a lot of like book work or testing and stuff at that point. So I don't think it really counts. However, it was really tough having kids as a resident, especially going into my intern year, which is a really tough year in general because you work a lot, you're learning tons of new things and everything is brand new basically. And like being a full-fledged doctor and writing prescriptions and stuff, it's really overwhelming. They sometimes say like it's like drinking from a fire hydrant because you're learning so much so fast and the learning curve is just massive. So having 2 6-month-olds when I started my intern year was really hard, and that year was really challenging. So yeah, I mean, I don't know, you just do it. We knew that's what we wanted to do. My husband is super helpful. That year we had someone who kept the kids from 8 to 5 at the house. She would bring them up to visit me sometimes when I had downtime at the hospital, and we just made it work, but it definitely wasn't easy. Fave thing about New Zealand from a curious Kiwi. If you follow me on Instagram, you know I love New Zealand. We want to live there at some point. We've been twice. The South Island is incredible. So my favorite thing by far about New Zealand is the hiking on the South Island. It's incredible. It's beautiful. You can be at the ocean and then turn around and there's mountains and then beautiful hiking and these glacier lakes that are just solid blue. I love pretty much everything about New Zealand, but I love the hiking. Also, I love Jacinda, their prime minister. So I was actually in the car the other day and I was telling the girls, my twins who are 7, that there had never been a president who was a girl, but that in New Zealand, the president, well, it's a prime minister position there, but equivalent of the president is a girl and she's a mommy. And one of my 7-year-olds was like, oh, you should text her and tell her that we think that's really awesome. And I was like, well, I don't have her phone number. And she was like, is she not your friend? And I'm like, I mean, I want her to be my friend. Like in my dreams, she is my friend, but no, we're not friends. And the other one said, does she watch your videos on YouTube? I bet she watches your videos on YouTube. She definitely watches your videos on YouTube. You should just ask her for her phone number so that you can text her because she probably watches your videos. I'm like, yeah, I'm sure that the Prime Minister of New Zealand in the middle of a pandemic is like, what should I do today? I'm gonna watch some random American doctor's videos on YouTube. But hey, Jacinda, if you're watching this, I love you a lot. You're very amazing. Thanks for being a good person and an excellent example and helping your country handle COVID so beautifully. I love it there. As soon as you'll open the borders, I'm coming back. So let me in. Okay, I'm done. Some of these questions are things I can't answer. So I just want to make it clear, if I ever ask for questions, like you can suggest a topic or ask a question about a thing, but I can't answer your personal medical questions. You know, like that requires me to have a doctor-patient relationship with you, which is not what this is, and that is illegal. I could lose my medical license. So please don't email me or message me personal medical questions, and definitely don't send me pictures of your personal medical problems. Like, I can't help you, and it just makes me feel guilty that I can't help you. And honestly, I just want to tell you a secret. I don't read them. When you email me your personal medical questions, I don't read it. Are you going to revenge prank Dr. Mike? If you didn't see the video, Dr. Mike messaged me and asked me a very ridiculous question, specifically about menopause, that made me question the safety of his patients. I then talked to him on the phone about it, and he just kept insisting this crazy thing, and I was horrified. I told my husband as he was calling, I think Mike is maybe not a good doctor. This is very concerning. He let me go through talking to him for like 15 minutes before he was finally like, this is a prank. When I tell you I've never been more relieved in my life, I really thought I was going to have to get the names of all of the patients that he's treated and call them myself. I was so concerned. The video is really funny, but I don't even think it does justice to how, I mean, for days I was messaging him after that, like, I'm so relieved that that was a joke. I was so worried about you. The question is, are you going to get him back? And here's the deal, guys. I am not good at pranks. I get very uncomfortable very quickly. I will try to even tell a joke sometimes, and if I can tell like the person is a little uncomfortable, I'm like, no, I'm kidding. Like I'm not good at it. I can't play pranks on people. I'm so bad at that. So I don't know if I even possibly could do that. If I do get him back, I'm gonna have to come up with something really creative, because he's gotta be expecting it. Like, I can't just go the same route that he went and like ask him a crazy question, because of course he would know what I was doing. So I don't know. Probably not, but If I think of something good or you guys tell me something good, then maybe. What are your kids' names? We have twins who are 7 that are both girls. That is Amelia and Reese. And we have a 4-year-old little boy, and his name is Milo. And we have a 1-year-old little boy, and his name is Pax. His name is actually Paxton on his birth certificate, but he goes by Pax. What causes the egg to split and develop into identical twins? That is a really interesting question because we don't know. We don't really know what causes that to happen. So fraternal twins, where someone ovulates 2 eggs, so you ovulate twice, maybe one on either side, or 2 eggs from one ovary, that would mean you, if they both got fertilized, would have fraternal twins, and they come from 2 eggs and 2 sperms. But identical twins have 1 egg, 1 sperm, they meet, they make a zygote, and then that splits into 2. And we don't really know why it happens, and it's fascinating. There's some interesting theories that go along with it, but the end of that is that it seems to be somewhat random. That doesn't run in families. So when people talk about twins running in families, identical twins don't run in families. Fraternal twins run in families because of a increased chance of ovulating 2 eggs when they have a family history of that happening. Like if a mom had that and her daughter would be more likely to have that. How's tiny house living? So for those of you who don't know, and eventually we're going to launch our travel channel, but we had intended on spending this year traveling the world. We had one-way tickets to Hawaii for June, and we were supposed to be in Japan after that, and obviously that didn't happen because of COVID. Well, we had already pretty much sold everything or given away, actually we gave away most things that we owned, and also we sold our house, and also I had quit my private practice job. So we moved to a teeny tiny cabin on my mom's land, and I got a new job as a hospitalist, which is good. I'm glad that I'm able to work. I miss private practice, but this is a good setup for now, and it's super flexible, which is what I need right now. We are living in a tiny 1-bedroom cabin. Like, it doesn't even have a door to the bedroom. It's just like a bedroom with a bed and a hallway to a living room and kitchen. It's basically a hot plate and a microwave and a mini fridge and a table. And in the living room, there are 4 beds for the kids. It's okay. I'm going a little crazy, but it's just not enough space for 6 people. Like, you can't, it's just not enough space for 6 people. I am all about minimizing and like not having a giant house when we buy a house again, but this is excessively small. I'm just glad we have lots of outdoor space to go run around because we can't stay in there all the time. And also, my mom lives a very short walk away and has a normal house, which is where I film these videos. So it's not like we can't go and get other space. The kids are ready for a little more space too. I don't think I've been doing my audio. Oh no, it is. Whew. My brain is still not firing on all cylinders. Oh, someone wants me to share my birth stories. I have shared my birth story with Pax, my youngest, in a video like a year ago, maybe a year and a half ago. I've shared my birth story kind of, I think, with the twins on my blog a long time ago, but I've been thinking maybe I'll do my other birth stories because people ask me that a lot. Also, my mom, who is a labor and delivery nurse, wants to do a video where she talks about her pregnancy with me. So maybe a joint video with my mom sometime. Would you guys like that? You want to see a video of me and my mom talking about Mama Dr. Jones as a fetus? Mama Dr. Jones coming on the channel. Mama Nurse Jones. Oh wait, her last name's not Jones. You know, I didn't get enough sleep last night. I saw your baby chicks video. So cute. Do you guys have any other animals? If you aren't following me on Instagram, then you may not know, but actually, I don't know what order these videos are going to be posted in, but at some point, baby chick named Uno will make an appearance in one of these videos. Anyway, we are currently, like I said a while ago, living on my mom's land in another house and tiny cabin. And they have a bunch of animals. So there are living here with us 2 horses, 3 goats. We have a bunch of, not a bunch of chickens, like I think there's half a dozen chickens. And now we have 5 new baby chicks, and they have 3 dogs. And we have a dog who is a cattle dog, and she's elderly and getting very, very sick, just has terrible arthritis, and it's really sad. She's been our baby forever. But yeah, those are the animals we have right now, and we love animals. One of my daughters really loves cats, and I would love to get her a cat, but I'm so allergic to them. But maybe someday. She loves them so much. I just read in a comment that you are 5'2". How tall is your husband? Can we get a comparison pic? I will throw a picture up here in the video, but yes, I am 5'2". The most common thing that you guys say when you recognize me out in public, oh my gosh, you are way tinier than I expected. This is because my personality is 7.5 feet tall. I only grew into 5'2" of that. And I operate on a step stool because I am miniature sized. My husband is 6 foot, a little over 6 foot. And I will throw a picture in so that you have a comparison. He's very handsome, ladies and gentlemen, if you're into men. He's very handsome. Oh, good question. Who are your most recent fave YouTube discoveries? One medical and one not. My very favorite YouTube genre of the current time is true crime. I am obsessed. I have watched every video on Kendall Ray's channel, and I also really love Eleanor's channel. I'm sorry, I can't think of your last name. I've watched almost every video of hers as well. It's making me extremely paranoid. I have to stop watching these videos about people getting murdered. It's making me have nightmares. I'm like, I have to stop, but I can't. They're so interesting to me. Medical, I mean, I have a lot of people that I really like, medical channels on YouTube, but I don't watch a lot of medical content. I mean, it's not enjoyable to me to watch medical content. Probably because I, do this all the time. Obviously, I love Dr. Mike and Dr. Mike's channel. My friend Jamie Rutland has a great channel. He is a pulmonary critical care intensivist, and he does excellent videos on COVID and lung diseases and all kinds of things. He's really, really good. My friend Natalie has a channel, and she's a reproductive endocrinologist, and she also has a really great Instagram if you're interested in learning about fertility and all of those things. So yeah, check out Dr. Mike. I'm sure most of you already know him. Jamie Rutland, Medicine Deconstructed is the name of his channel. Natalie Crawford, her channel is all about fertility. Austin Chiang is a GI doctor, and he has a really great channel. Rena Malik is a urologist. There's tons of really great YouTube channels with medical content. And obviously Christina Braley is a friend of mine, an anesthesiologist with an amazing channel. There's so many great channels. That's not a comprehensive list. Like, I'm not trying to leave anybody out. I'm sorry. I also really enjoy commentary community, and the comedy people. So I really like Cody Ko, and I really like D'Angelo Wallace. Jarvis Johnson, hilarious. I really like his channel. There's lots of them that I like, but yeah, not as many medical ones that I watch frequently, but there's lots of medical ones that I like. I just don't like watching all of those videos all the time. How do you feel about certified nurse midwives? I love certified nurse midwives. They are wonderful. I feel like it's a very underutilized profession in the United States, and that we should do better to mimic European models and have more certified nurse midwives. I currently work in a system where it's always me and a certified nurse midwife that are on call together, and I love that. I'm really enjoying that, like, working together, and I think they're awesome. Nothing bad to say. I love the CNMs. This is one of the most common questions that I get when I do these Q&As. Do you want to have any more kids? I think I've answered this in lots of videos, but the short answer to that is I love being a mom, and I would love to have more babies. Wanting that and actually deciding that we're going to do that are two very different things. We're not completely no, and we're not completely yes. Like, it's not off the table, but also at this point we're really happy with 4. The level of chaos is astronomical. I'm 34. I have plenty of time to still have babies if I want. We would never, I don't think, seek out fertility treatment or anything like that if it didn't happen. And we had trouble getting pregnant the first time with the twins. And so I don't know. Guess you have to stick around and find out. If you're not subscribed, hit subscribe so you make sure you know if we end up having another baby at some point. I've also had 3 C-sections. I don't know how I feel about doing that again. But what was your undergrad degree in? My undergrad degree was psychology. Have you ever watched The Business of Being Born? Thoughts? I have so many thoughts on that. And actually, Ricky Lake is coming out with The Business of Birth Control now. Just prepare yourself for me to have to react to that. I would do a reaction to the business of being born, but I just don't want to watch it again. So if you guys really want me to, let me know and I will rewatch it, but it makes my brain hurt. Can birth control make a gay woman like men? No. What was each of your kids' first words? I don't know. I'm sorry. That's terrible. I have no idea. I know Pax's first word was mama, and I only remember that because he's the only one of my kids who that was like anywhere close to their first word. I'm sorry to my other children. I don't know for sure what your first words were. All right, last question. Is it safe to get vaccines while pregnant? Some vaccines are safe in pregnancy and others aren't. We don't give people live attenuated viruses in a vaccine. So like the MMR vaccine, you can't get that while you're pregnant. We don't do that during pregnancy. Inactive vaccines are, for the most part, considered safe in pregnancy, and 2 vaccines in particular are specifically indicated in pregnancy. So the Tdap vaccine between 28 and 32 weeks is given to reduce the chances of getting whooping cough, pertussis. I had a brain freeze for a second. That's to lower the chances of the parent getting pertussis and giving it to baby before baby's old enough to be vaccinated. So we give it in every pregnancy between 28 and 32 weeks to boost antibodies, because some of those go through the placenta to protect baby, but also to decrease the chances that the parent will get it. So we also recommend that anyone living in the house or who's going to be around the baby a lot in the first few months of life also make sure that they're up to date on their Tdap or pertussis vaccine. The person who is carrying the baby needs that vaccine in each pregnancy, and the other family members just need to be up to date in the last 10 years. So we also highly recommend a flu shot in pregnancy. The reason for this is that people who get the flu while they are pregnant have a tendency to get very, very ill and a much higher chance of ending up in the hospital and in the ICU on a ventilator. I have seen very, 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 very sick people because of the flu in pregnancy, and I have seen people lose their babies because of the flu in pregnancy. It is not a joke, and I know that the flu vaccine is not 100% and it doesn't always protect you from getting flu, but it's more than no percent, and it helps also to reduce the severity of the illness. So even if it doesn't keep you from getting influenza during that season, it does reduce the chances that you would have really severe disease. It makes it not last as long and you're less likely to get hospitalized. So highly, highly, highly recommend both of those vaccines in pregnancy. All right, guys, I hope you enjoyed this Q&A. If you want to watch another video, you can click a link right over here. If you're not subscribed, hit that subscribe button. Be kind to yourself, to each other, to me. In the comments, be kind, and I will see you next time.